Most common injuries for female athletes kind of fall into two categories. The first is overuse injuries, and that's patellar tendonitis, or we would call runner's knee, or patellofemoral pain syndrome, which is all kind of related to muscle imbalance, muscle tightness, and core and glute weakness. And then traumatic injuries, probably the most common thing I see is ACL injuries, just with our active patient population here. I think a lot of it has to do with our anatomy. We tend to be wider hipped and more narrow kneed, and so that puts a little bit more length between our hips and our knees and can stretch tissues in different ways. And then we all tend to be a little bit quad dominant because we use what we see, and we tend to neglect our posterior musculature, kind of like our glutes and our hamstrings, and so we tend to overload the front of our knees. But honestly, I mean, as long as you cross-train and do the things you need to do, I don't think there's any real detriment in being a female versus a male. Everyone's got a different combination of issues that are presenting as the same diagnosis, and so you need someone who can identify the issues and the pathology and really hone in on that and teach you how to isolate those issues and really focus on building them up. I think yoga is really helpful to supplement that because it really builds a mind-body connection and teaches you to engage different muscles to create stability in the joint. One of my passions is taking care of female athletes because I was a female athlete, and I think that while a lot of our injuries are similar to the male athlete, I think it's helpful to have a female perspective and understanding what motivates women to do the things that they do, and I want to keep them out there and keep them at their best.